Welcome to the Soulstem Podcast, where we explore healing at the intersection of mind, body, and spirit. I'm Topher Scott. I'm a licensed professional counselor associate in the state of Texas, supervised by Leslie Smith, LPCS.
And I'm Dr. Kenny Mittelstadt, a functional medicine practitioner and acupuncturist trained in systems-based root cause care in Texas, California, and Florida. On this show, we go beyond the quick fixes and into the deeper layers of healing through the lenses of counseling, mental health, and functional medicine.
We are here for the seekers, for those of you who have felt dismissed, pathologized, or left wondering if the system missed the point entirely.
And if you've ever left an appointment thinking they didn't really hear me, or I still don't understand why I feel this way, you're not alone.
Today we're asking a big question. What's missing from modern medicine? We're not here to have a bashing session, but instead the goal is to have an honest conversation about the blind spots and what's needed from a systemic standpoint to start reimagining healthcare.
All right, so let's pull that thread, shall we? Topher, what informs your perspective on what's missing in modern medicine today?
When I think about what's missing, especially in mental health, it's really complicated. I'm just starting off my career as a counselor, and this is my second career. But if I really look over my lifeline, I've been around medicine my entire life. My mom's an anesthesiologist, and I grew up in hospitals and in clinics. That was just a part of my day-to-day background growing up. And I started working in a clinical environment around the age of 14. And I think that lived experience coupled with my education and my shift into counseling, it shapes a lot of how I see things. Tell me, Kenny, what informs your perspective on what's missing in modern medicine from a functional medicine standpoint?
Yeah, mine's kind of multifaceted. I found functional medicine through my own health struggles. I had some chronic gut-related issues, reflux, fatigue, insomnia, really frustrating time in life, and ran into that typical experience, quote unquote, of my labs being normal and being treated like a bag of isolated symptoms rather than a whole interconnected person. Between my personal experience and then now seeing patients every day, they echo those frustrations where they've run into that same thing. Everything looks normal, or they've tried everything, but their health keeps slowly and sneakily slipping out of their grasp. And from the clinician side, I've spent years in practice now alongside conventional practitioners, and I see a lot of caring practitioners, but they're trapped in a system that rewards speed and symptom suppression over connection and root cause investigation. So it runs pretty deep. So Topher, what are some of the more granular or larger themes that you see impacting mental health today?
Well, first, I want to just say thanks for sharing your own background, both as a client or as a patient, but also as a clinician. I shared a little bit about my story, my struggles with mental health in the last episode. So I'm not going to revisit that, but I will say I completely identify with it also from the client and patient side. And what I see today as being a bigger theme and issue is that we're in a full-blown mental health crisis in this country. I think the sad and strange part of it for me is just knowing that we are one of the most industrially advanced countries in the world and one of the most affluent countries, arguably the country with the greatest resources, or at least that's what we hear echoed all the time. But yet we have some of the worst outcomes in physical and mental health in the world. And I think that problem has really metastasized since COVID. It was going on before, but it just keeps getting worse. And we really see a real gap in providers. There's a huge discrepancy. I'm curious from your side, what forces are you seeing impacting people's health today?
Yeah, I appreciate your perspective. And talking about physical and mental health, they're interconnected. It's so important. A few of the drivers I see, the fact that we live in a chronic stress culture between work demands and the hustle mentality that's just so prevalent that really sets the stage for a lot of chronic complex illness when we talk about the hormonal results of chronic stress, and especially how sneaky it is. And then, of course, our processed food environment, the lack of nutrient dense foods in the standard American diet, the cumulative load and body burden of things like toxins and mold and air quality, and then sleep deprivation. We're getting it in all angles, basically. I almost mentioned all of the lifestyle foundations that functional medicine really focuses on. And then lastly is this culture around quick fixes between medications, fad diets, supplement stacks, without a huge focus on the foundational habits that create health. I think another inefficiency that maybe isn't talked about a lot in the modern space too is this idea that there's a turf war between what is conventional and what is complementary. And truly what we see in the research is that the best health outcomes come when we can integrate the two together. Integrative health has a place and deserves attention in our society at large. So I'm curious too, what do you think are the biggest issues from the provider side in mental health?
Well, I think what you just laid out, there's a lot of overlap. I see a lot of those same themes. I think about the lifestyle components, dietary stressors, lifestyle stressors, sleep deprivation. And I see it on both sides. That's for clients, but also for clinicians. And for me, I think one of the biggest issues, just kind of overarching that trickles down, is what happens on the provider side in mental health with cost and access to education being a huge part of the issue. And we're having such a big discussion about this in society right now with a huge portion of the population struggling to address student loan debt. And I think this is a huge barrier. Just the path and the entry into the field is very daunting. There aren't enough incentives, but I think the central issue is that a lot of people burn out or leave the field. We're not producing enough providers. And so volume and the pressure to make profits push people into a very unsustainable workload, and it creates an unsustainable system that does not really lead to great outcomes for clients.
Yeah, that is so real. So what do you think it would take to make mental health careers more sustainable and appealing enough so that people actually want to enter and stay, maybe even more importantly, in the field?
That is the question, right? I think it's about lowering education costs or really reimagining if we should be applying a for-profit model to education at all. And that's a huge debate, and I'm not in the policy world, but I think it starts with everybody having access to education that doesn't come at a huge personal toll and cost. Along the way, we have to think about what helpers and clinicians face, which is that they face a grueling education. Even the counseling education is pretty grueling. And while we're preaching about self-care, we're actively struggling to try to figure out how to manage it and integrate it into our own lives while we're working with other people. And I don't think that stops in school. And we have to remember that they're also having to make time for notes, for supervision, for all sorts of things in life, and addressing their own well-being ends up somehow usually at the bottom for most of us. And you couple that with the debt, and many people end up feeling forced into a volume-driven sort of grind in their helping path one way or another. And I think if we want mental health workers to model healing and balance, if we want that for our clients, we have to have it ourselves too. It's hard to be able to support them in something if we can't walk that walk because the systemic barriers prevent it. And I think in the end, if we don't address this, we're just setting everybody up for burnout. I'm curious, Kenny, what about functional medicine? I know that was quite a bit there in my perspective, but what challenges do providers like you face?
Yeah, I appreciate your honesty too. And there is some overlap, of course, in my space as well. One of the first I think of with functional medicine in particular is standardization of training. There's a lot of variation out there, especially when it comes to functional medicine gaining more traction in the corporate space. We're seeing more watered down approaches or people taking 10 to 50 hour courses and saying they practice functional medicine when it really is a paradigm shift at its core. And so standardization of that training and understanding, because it's also open to professionals across licensing types. You can be an MD, a DO, just as much as you can be a DC or an acupuncturist and practice functional medicine. So it's more about what are those common threads that look at root cause care and deprioritizing drugs and surgery when possible as the main intervention guidelines, and then how to do that safely based in clinical evidence. So that's what a standardized training needs a little bit more of, I would say. And then also functional medicine consults are longer. They're very personalized, and insurance does not reimburse well, if at all, for those kinds of visits. So it's harder to sustain without burnout. And again, that volume-driven grind that a lot of practitioners face. Patients also often come in as a last resort. So the cases attracted to functional medicine practitioners are often very complex. They're multi-layered. They require a lot of detective work and time. There's a bit of an emotional load and burden that is demanded of practitioners who see these patients day in and day out. It's something that I love to do, but definitely can be a heavier thing, which I'm sure you see in mental health too. And then also the business pressures, I think, in the functional medicine space, because it's not as integrated into the conventional model, practitioners are often wearing the hats of clinician, administrator, marketer, entrepreneur, all at once. And so that can lead to those same overwhelm and burnout type pressures that we see. So another big challenge that I know I see in the conventional space is around time with practitioners. Most patients only get 7 to 15 minutes with their practitioners. So what impact would you say that has compared to the mental health space as well?
Well, it really depends on which part of mental health we're talking about. If we look at the spectrum of care, we have outpatient counseling, which can include individual therapy and group therapy. And then going into a higher level care, we might see intensive outpatient, then residential treatment, and then hospitalization. And then within that spectrum, we have all sorts of different providers. I think it depends on who you end up seeing. Short visits are very common with prescribers. And I think that is an issue that trickles down through the whole system because it sets a tone for what treatment looks like. And oftentimes, especially in our society, the first thought is to go and pursue medication treatment. And coming back to that 7 to 15-minute visit, again, that has to do with what? A shortage of clinicians available to treat that volume. And so they get squeezed into this high volume drive-through prescription approach. And what really gets presented in that space of time is symptoms, and symptoms get flattened into a diagnosis. Diagnosis gets translated usually into a prescription. That right there, I think, has a huge impact. And going back to what you said earlier about quick fixes being one of those key issues. And I'm going to put a period on this because I think there's so much to talk about from here. But what ends up happening is a lot of people don't get to explore the why. They don't get the education, they don't get the processing, and they don't get the integration in 7 to 15 minutes in an occasional visit with the prescriber. And that's not the prescriber's fault. That's a system problem.
I really love that you're focusing on the why. It's one of my favorite questions in the functional medicine space too, but can you say a little bit more about the why piece?
For sure. There are so many examples I could draw from, but when I think about when somebody starts on an antidepressant medication, if they have that process, a short process, 7 to 15 minutes where they got to describe their symptoms and they got a medication, it really doesn't leave a whole lot of time for education about the treatment process and about expectations, about adverse effects, about the communication process. And I'll give you an example. If you start an antidepressant, it's really, really helpful to know that it's probably going to be a journey with that takes some time. And there may need to be a titration up in dosing to get to a certain effect with the medication. And if the medication does have really pronounced adverse effects for the patient, that really needs to be communicated with the prescriber. And then the prescriber should be able to guide the client either to titrate down off the medication without sudden termination and start a new treatment approach, perhaps with another medication, following that same process of titrating up, checking for adverse experiences and progress. And if it's not working for the patient, then titrating off. But the sudden termination is very problematic for mental health because it can really disrupt things chemically and make things worse. But again, how is anybody supposed to know that? How is the prescriber supposed to really advocate and educate the client in 7 to 15 minutes? And again, I don't really blame the prescribers. I think this is a reality of the system that we're working within, and there's just not a lot of emphasis on psychoeducation and all of the other processes that go along with healing. Not to mention that masking symptoms is often what happens with medications. We might see symptoms get blunted, but again, it's not asking why the symptoms are there to begin with.
That really is huge. And I appreciate that you spent some time on the different levels of care earlier. You mentioned patients not knowing about other options available. Could you speak a little more about that?
Absolutely. It's a huge problem. I don't believe that most people know that there are options besides therapy and psychiatry, but there's a whole spectrum. Absolutely. From individual and group therapy, which usually happens on a weekly or biweekly or monthly basis, depending on the needs, to the next level, which might be intensive outpatient programs, where somebody is in individual therapy plus about 9 hours of group counseling. And we might see this for active substance use or active self-harm. A little bit higher risk, but somebody who doesn't qualify for residential care. In other words, they can access that, but still be in their home. Then we have the next level, which is the residential version of that, where you're in a residential facility and you're experiencing more care and more staff. And then there's full hospitalization. I don't think I have to explain that one, but each level offers different support. And again, patients often don't know how to access that or what's best for their needs. And it's helpful if they have a clinician that can help first assess for their needs. Mental health roles also vary widely. I mentioned that before. I think that lack of education and advocacy creates barriers and confusion for most people. And it makes it that much harder for people to actually explore mental health because we don't know about the specialists within it as much as we might in other fields. And I know this is probably really relatable to you because I don't think a lot of people understand the nuances of functional medicine and what it means exactly. What is it that functional medicine practitioners do? That's my assumption, of course. I'm curious, how well do patients, in your perspective, understand the spectrum of care in functional medicine? And how do you educate them on that process?
Yeah, you're quite right. I get the full level of experiences, and oftentimes people will find me through some of the larger public facing channels. I think of public figures like Dr. Mark Hyman, who's really big in the functional medicine space. And what I do run into a lot of times is most patients think that functional medicine is just substitution medicine. So, what I mean by that is instead of a medication, they come in sometimes just expecting a supplement instead of that medication to fix them passively, or that it's, a natural alternative to medicine. And I'd say that falls a bit short of really the depths of functional medicine philosophy. There's really a whole spectrum of experiences and care teams involved in functional medicine experiences too. So that variation I know makes it confusing for patients, but you can see things like group visits, advanced functional labs, and supplement or lifestyle protocols. And then also looking at alternative and complementary modalities in addition to conventional medicine. So, in a way, I think of functional medicine as bringing the best of all of the worlds and perspectives together. It gives equal weight and validity to some of these modalities that maybe are outside of the conventional awareness and paradigm. And it's still grounded in research. And I think that's an important point to make as well. So when patients come in with their first visit, when it comes to educating them, I try to help and set expectations up front. We're really starting to change the language around care. I'm not a dictator in their care telling them what to do. I'm going to create side by side things that help move the needle in their health from the inside out. And instead of taking this outside in approach where we're taking a medication or a supplement expecting something to change in spite of us or in spite of our situation, we're focusing a lot on the situation as well. And so that re-education is oftentimes focusing on the fact that healing is a process. We talked about this in the last episode too a bit. It's not an overnight switch. And we're trying to slowly go away from the quick fix model in terms of patient education, because what happens on the other side of that is that the power starts to return to the patient. Instead of looking externally for the fixes, they can start to recognize there's so much internally that can be done, and naturally without having to affect the rest of the systems and our bodies. I take a very food first approach and supplement approach, and we go to lifestyle interventions to really create the foundations that drive health. And one thing I always like to draw attention to is kind of the spectrum of strength of interventions with patients. We have, of course, grown up in a paradigm where medicine is super powerful. It kicks the door down in our chemistry, basically, and says, you don't really get a choice to work or not work. We're going to change this enzyme function or turn it on or off. Food, of course, is one of the slowest ways to do that, but also very profoundly powerful when we're sticking to it, at least the 80-20 rule. And then supplements lie somewhere in the middle. I think of it as concentrated food interventions sometimes for patients. It depends on the supplement, of course, but that reframe is what I really focus on with patients. And when we slowly start to integrate that is where the profound and lasting change comes in. So I'm curious too about some of the re-education maybe around this in mental health, and especially with medication reliance. What's your take on that in the mental health space?
Well, of course, medication can be life-saving. I think to speak about it, I have to put some brackets and just kind of speak to psychopharmacology, the medications that really pertain to mental health. When we talk about psychotropics, what I will say is that oftentimes, not always, we're talking about symptom management and not necessarily addressing root causes, because the mental health challenge that clients often face isn't a deficiency of medication. There's a different root. Sometimes it's trauma, it's safety, it's lifestyle, it's systemic issues. Could be a whole host of issues, and some of them can be very layered too. When a client comes in and they present the symptoms, but we don't really know the backstory, and then we give them a drug, then it tends to mask the problem. Again, I'm not a prescriber, so I'm not the one giving out the drugs, but I do see the client when they get into therapy and suddenly their drug's no longer working. They've been on an antidepressant for 2-3 years, and at first it worked for a while, and then slowly but surely it's no longer working, and they're wondering why. And that's because the underlying issues have not really been addressed. The system favors quick fixes and convenience, and it advertises that way as well. It trains us to seek quick fixes. I'm curious, how does functional medicine view this issue of medication reliance and maybe approach it a little differently?
Yeah, that just rang so true for me too. I really love everything you had to say and the way you framed that. And to boil it down, it's kind of the same thing where we don't see depression as a Prozac deficiency, for instance. It begs the question, why? We don't stop with a diagnosis, which is really just a way of describing what we're seeing. It's a language of description. It's not a language of reason and why. And so I think that's something that we really have to retrain our society and our culture on, because the root cause or root causes more often, I'm going to say it's oftentimes more complex because we are not isolated symptoms. We are interconnected beings. That's what we do is we turn the focus to why, what is driving this dysfunction on the spectrum of function to dysfunction, not just you have a diagnosis or you don't have a diagnosis on the far ends of the spectrum. And then to really tease out root causes, I mean, it involves a lot of things, but usually I get 70 to 80% of the most important information by just spending more time with a patient and taking a very detailed health history. Their story, their timeline reveals a lot. And functional medicine gives a lot of weight to the cumulative experiences across a person's individual timeline. I always tell my patients that where some of our experiences and our chemistry at the moment you come and see me is a manifestation of those experiences over your lifetime in some way, whether it's the way your nervous system has been programmed or the way your hormones are reacting to certain situations. And so we're looking for triggering events or how the stage was set for certain conditions. And those become the levers to pull, whether through lifestyle interventions or targeted supplement therapy, for instance, or referrals when necessary, of course, too, because this is integrative in nature. But that's a huge shift of focus when it comes to teasing out root causes through the functional medicine lens. So our goal is really to restore function from the inside out, not just to control symptoms and taming them and masking them through the conventional paradigm. So obviously, in counseling, you get to spend a lot more time with patients. How would you say that changes outcomes and the experience overall?
Well, I'd say the first thing is that it really gives an opportunity for the client to be heard and seen, and for us to do the deep exploration, to go through a deep assessment process. The intake session is an hour, sometimes more than an hour, going through the client's biopsychosocial history, getting a sense of what their goals are and what their strengths are, and exploring the history of the issue. Sometimes that goes back to in utero for certain clients. And all of that is so important because the issue didn't emerge out of thin air. There were some events. And I think that's where counseling is a little bit different because we have the space for the story and the exploration. There's an opportunity for skills building, for education, and for integration, for incremental change, because change doesn't just happen. And a lot of change thrown at a person all at once is overwhelming, and a lot of people don't succeed with that. Counseling is built for incremental change, and that's why it is a protracted process. On average, you're going to see minimum timelines are probably 8 weeks to 12 weeks. And for some people, they're going to need more support for a longer period of time. And it's also adaptable.
Yeah, there's so much overlap here too. And I've got to say, it's incredibly priceless when I have a patient that's also seeing a counselor or a therapist because we're talking about some of the same things. Behavioral change is not easy. Incremental changes and looking at the factors that are really throwing roadblocks into their ability to change and to integrate them is what really helps to drive the most lasting success. And we're talking about lifelong health here at any stage of life. So I really appreciate your focus on that and in the counseling space in general. But for me and my functional medicine visits, my initial visit's about 60 to 90 minutes, depending on the complexity. And same thing, we're diving into the timeline from birth or before birth to present day. And then follow-ups are around 45 minutes. And so we really get to talk about some of these things, the details. What roadblock have you had since I last saw you a few weeks ago, not months or protracted timelines in between visits. And then, like I said earlier, is co-creating with the patient, involving them in the decision-making process, and making sure that education is woven in along the way. I attempt to break down some of the jargon because I know it can get really dense in the functional medicine space when we're talking about advanced functional labs. It is all Latin-based chemistry terms, and very, very tough to decipher. But my goal is to explain the why behind any recommendation I ever have, whether it is supplement or lifestyle, and ground it in their own understanding of those objective pieces of lab data. So it kind of connects it to their unique physical story, all the while keeping in mind the human, the whole complex, interconnected human that is in front of me as well. And then validating lived experiences. I hear patients all the time come to me saying their practitioners have said it's all in their head, or no, that's not it. And they kind of dull their intuition over time. That just, slowly again strips the power away from the patient in feeling like they have the autonomy and sense of self enough to make decisions about their healthcare. So that's a huge focus of mine. If you had to sum up one of your biggest critiques of the current mental health system, what would that be?
I think there's a lot of what you said there that I can really echo. I think at the end of the day, when we sum it up, it does trickle all the way down to clients not really getting the care that they need. And there are four big things that I can kind of distill from all of this. And it's one, the barriers to entry and lack of incentives for providers to enter the field of mental health, the high education costs, these short visits that are part of the systemic issue and the economic issue, and the over-reliance on symptom masking and medications as opposed to working with medications and trying to get to root causes at the same time. Because I don't think it has to be one or the other. I think we actually see outcomes really improve when we have pharmacotherapy coupled with other interventions like therapy or functional medicine. And if we started getting more collaborative and we started asking why more and started looking at the system a little bit more, I think people are going to start feeling better and getting better. From your lens, what are the biggest critiques that you have for the current medical model?
Yeah, just beautifully said. I appreciate your points and articulation there. For me, it's the difference between acute care and chronic care, where the conventional medicine space, no doubt, is life-saving and helps in emergent and urgent situations and with real stark pathology. But it is lacking the support and the systems when it comes to chronic complex illness and prevention or health optimization. Also, the fact that conventional labs, the routine ones that are usually done in primary visits, for instance, are not sensitive enough to the spectrum of function to dysfunction. And it's a very rigid black and white, yes diagnosis or no diagnosis system. The time constraints, of course, as you said, there's just not time for the deep investigative work. And then also I want to speak a little bit to reductionism and specialties, where the current system treats a human like their body systems in silos, right? You see your rheumatologist or your cardiologist or your gastroenterologist, rather than intricately interconnected. Functional medicine often sees how when function goes offline in one system, it affects the other. We are connected at the end of the day. And this is something, too, that I'm even a little concerned about in the functional medicine space, if I'm honest, is that we need more people being generalists as well, who are competent enough to recognize the spectrum of possibilities rather than sticking to strict protocols. And what I see in both of these spaces as it gets a little bit more watered down, both the conventional and the more superficial functional space, is that we run the risk of everything looking like a nail when we are a hammer. And then lastly is just the lack of nutrition and lifestyle training and the focus of nutrition and lifestyle as primary interventions for chronic complex illness and the support that's needed for behavioral change.
Very well said. And I would echo a lot of what you've just said there, especially on the lifestyle and nutrition as being primary interventions and pushing out some of the more extreme interventions, reimagining how we explore interventions too. What do we begin with? Should we begin with an antipsychotic, or should we begin maybe with some counseling? And so I think that's a really good stopping point. However, for this episode, so much to talk about there. And I just want to say thank you to our listeners for joining us today as we explored some of these blind spots in modern medicine and how quick fixes often overshadow deeper healing, and why truly addressing root causes requires time, education, and compassion for both patients and providers. And next time, we're going to dive into a topic many experience but few talk about openly: burnout.
I can't wait for this one. In our next episode, Burnout Isn't a Personal Failing, we'll unpack how exhaustion and overwhelm are systemic issues, not individual shortcomings, and how healing requires us to rethink the culture around work, wellness, and self-care.
Thank you for being here with us on this journey. And until next time, be kind to yourself. And remember, healing is a process, not a quick fix.
For a fresh dose of science and soul, be sure to follow and subscribe.
Find us on YouTube, Apple Podcasts, Amazon Music, or Spotify. Thank you for tuning in, and see you next time.